Good morning. My name is Sarah Selzer. I'm a Doctor of Physical Therapy student at the University of St. Augustine. How are you doing today?
Good, thank you.
Can I get your first and last name?
Yeah, Addie Stewart.
All right, and what's your date of birth?
November 18th, 1992.
Okay, can I check that on your bracelet to verify? Great. Okay, so today we're going to be doing a little bit of cryotherapy, which we're going to be using a cold pack.
Okay.
This is to decrease pain and swelling that you're having over your due to your carpal tunnel syndrome.
Okay.
So I see on your chart that you do have the diffuse pain and swelling, but could you point to me around the area?
Yeah, it's right in here.
Okay. All right. Also, from reviewing your chart, I saw that you don't have any of the contraindications that cryotherapy may have, so we're good with that.
Okay, awesome.
But if that's okay with you to apply the cryotherapy, I'm gonna have to put my hands on you.
Yep.
Is that okay?
Yeah.
All right. All right. So before we do treatment, I'm just gonna be checking the skin to make sure that there's no abrasions or you don't have any wounds that need to be addressed, which you look good. So, and then can I palpate the spot where you're feeling pain? All right.
Yeah.
How's that?
Yeah, right.
That's right there? Okay. All right, well, we'll help you with that. So what we're gonna do is I'm gonna be testing your sensation.
Okay.
So what I'm gonna do is use this cotton swab. So since it's the left side that's affected, I'm gonna test your right just for sensation first, just to let you know how it feels, okay? So I'm using this cotton swab.
Sounds good.
So I'm just gonna do that so you get a feel for it.
Okay.
So what you're gonna do is close your eyes for me, please. So right there, feel that?
Yep.
Do you feel that?
Nope.
What about that?
Nope.
What about this?
Yep.
Okay. All right, good. So now what I'm gonna be doing is testing your left side, so keep your eyes closed like you're doing. And I'm just gonna be testing for sensation. Do you feel that?
Nope.
What about this?
Yep.
What about this?
Yep.
Do you feel that?
Nope.
All right, there we go. Okay, so now that I've tested for sensation, I'm just gonna have you actually right in this position. So what you're gonna be feeling when I apply the cryotherapy is you're gonna be feeling cold first, then a little bit of burning, then some achiness, and then numbness. Okay. If that feels okay to you, is that all right?
Yep.
Okay.
Yep. Sounds good.
So after applying the cryotherapy, what I'm going to do is leave you this call bell. So if at any time after I've set the timer and have gone off, if you need me, you can just ring the call bell like so, and I'll come to assist you in any way you need. All right. So what I'm going to do first, before applying the cold pack, is I'm going to put this damp rag over the affected area, right there.
Okay.
And then I'm going to apply the cold pack, right there. And then I'm going to wrap it in a dry towel, like so. All right, I feel okay?
Yep, feels good.
Okay, so now what we're gonna do is set the timer for, since it's the first time you're getting treatment, I'm gonna set it for 5 minutes, so 5-minute timer. So start that now.
Okay.
Here's your call bell if you need it. Okay, so 5 minutes have gone up, woo! All right, how are you feeling?
Good.
Good, okay. So what I'm gonna do is I'm going to just lift up the cold pack to see, to assess the skin. There's a little bit of redness, but that's normal after having a cold pack for a little while. So since the normal amount of time for a cold pack is about 20 to 30 minutes, I'm going to set you for 15 minutes. There, 15. And so we'll continue with the cryotherapy. Is that okay?
Yep.
All right, so start that and just let me know if you need anything, okay? Your call bell. All right, so now the time is up. I'm going to take the cold pack away. And what we're gonna do is I'm just going to, like I did before, reassess your skin. It's a little red, but that's normal when you get a cold pack or cryotherapy. And yeah, that's good. That's it for cryotherapy.
All right.
So next, what we're gonna be doing is a little bit of compression. So we're gonna be using an ACE bandage before we apply it. I'm just gonna inspect the skin again, make sure there's nothing, that would make us not be able to use compression.
Okay.
All right, we're gonna look again. anything, okay? So for compression, this is again to help decrease pain and swelling. So before we apply it, I'm gonna have you remove any jewelry from your hand. So if you could get your ring off for me. Thank you. All right, and then I'm also going to assess your capillary refill of your fingers. So I'm just gonna like give your fingers a little pinch, okay?
Okay.
All right. There, and there, and that looks great. Okay, so now I'm gonna apply the compression with this ACE bandage. So I'm gonna have you lift up like that. And if at any point this doesn't or gives you any pain or anything, just let me know.
Okay.
Keep on going. Feeling okay?
Yep.
All right, we've reached the end. So I'm going to put it on there. And so typically with compression, what you're gonna do for treatment is you have it on for about 1 to 2 hours.
Okay.
If you feel any numbness or like tingling or see an abnormal discoloration, you're gonna take it off.
Okay.
And then you just want to make sure that you don't sleep with it on.
Okay.
So I have this call bell for you here if you were to need it. And then so after the amount of time that you have your compression on, so now I'm going to take it, I'm going to assess your capillary refill. So, and then I'll take it off for you.
Okay.
All right. That feel okay?
Yep. Yeah.
All right, good. Okay, and then I'll just reassess one more time.